I'm excited to be back in Napoli for the 10th Immunotherapy Bridge meeting. Today, I presented on the strategy of combining agents that lacked single agent activity with agents that had activity, and the importance of doing this to augment immunity in patients which actually have low immune responses and are unlikely to respond to things like anti-PD-1. The arguments we made today were actually focused on doing serial biopsies to understand what the status, the immune status of a patient was at the start, and then how it changes with treatment. And we discussed this in the context of a combination immunotherapy trial that was just presented at SITC by Dr. Ram Leidner, showing that combinations of an immunotherapy that had a large number of antigens and cancerous dark matter could actually increase response rates in terms when combined with anti-PD-1 and other immunotherapy, really tripling the response rate and tripling progression-free survival time for patients with recurrent or metastatic head and neck cancer. We also talked about how this fits in with the concept and with the data that shows that neoadjuvant cancer vaccines combined with PD-1 are improving response rates and improving progression-free survival time or recurrence-free survival time in patients with melanoma and pancreatic cancer. But there's still much more that can be done. We also noted that it's 40 years ago, last Friday, that Linda Taylor, who was treated at the NCI, who was close to death and who has had a complete response with two agents for which we didn't have yet single agent activity. So this kind of celebrating 40 years of our first patient cured, and now at 40 years, really highlights the fact that we need to be combining these agents which have good mechanism of action, which have good rationale for combining them, and with solid clinical trial designs that include the aggressive monitoring so we can understand the impact of the agents, that's the way forward to improve outcomes for the vast majority of patients.